I am Dr. Chandroth, working as internal medicine specialist in Jeddah National Hospital, Jeddah. Today I will be speaking about systemic lupus erythematosus, commonly known as lupus. Lupus is the common term for systemic lupus erythematosus. Lupus is an autoimmune disease affecting many organs of the body. To create public awareness, May 10th and every year is conducted as a World Lupus Day. So let us see what is lupus. As I mentioned, lupus is a autoimmune disease. That means our own immunity will attack the different organs of the body. In lupus, many organs are affected, like the skin, the joints, the kidney, the brain, the lungs, the heart, the blood cells, etc. Lupus affects mainly females. 90% affected are females, only 10% males are affected. In females, it mainly appears during their childbearing age. That means between 15 years and 45 years. Let's see what are the symptoms of lupus. The symptoms depend upon which system is affected. Most of them have non-specific symptoms like fever, weight loss, general tiredness, fatigue, etc. And depending upon the system involved, the patient will be having different symptoms. If it affects the joints, the patient will be having joint pain or joint swelling. When it affects the skin, the patient may notice photosensitivity. That means when you are exposed to sunlight, you may get a rash, red rash on your body where the sunlight is exposed. Also, you can get butterfly-like rash on your face. Also, in skin you can get some scar-like lesions as well. Regarding joints, you may get either joint pain or joint swellings. Usually, when somebody have fever, joint pain and some rashes in the skin, we suspect lupus or SLE and should be evaluated for SLE. Other systems affected by lupus are, one is kidney, in which you may experience kidney damage, can be in a short term like acute, where you present with swelling in the legs or puffiness of eyes, or sometimes it may present with non-specific symptoms. Sometimes the lupus may affect the brain and it may present with seizures or with abnormal behavior or with sometimes even psychosis. When it affects the lungs, it may present with breathing difficulty on walking or on exertion, or sometimes with pain while breathing. When it affects the heart, it also presents with the breathing difficulty and pain on breathing. When it affects the blood, it may present with abnormal blood findings when we do laboratory tests. As lupus affects many systems in the body, it presents with wide range of symptoms. Sometimes it will be very mild and sometimes it will be moderate, or sometimes it will be very serious also. But most of them will have a mild to moderate disease and rarely it proceeds to a serious disease, especially when it involves the kidney or the brain. Diagnosis is usually made by when you visit a doctor, and he will assess your symptoms and the clinical features, and he will order some simple blood tests by which it is diagnosed as lupus or SLE. Getting early diagnosis and treatment is very important, because early treatment or early diagnosis can prevent further progression of the disease, or it can prevent further complications. Usually hydroxychloroquine is given as a treatment, but other medicines like steroids and some immune suppressing drugs are also given for this disease. On May 10th, as we conduct World Lupus Day, it's important to be aware of these symptoms, because many of your friends or many of your relatives may have these symptoms and may not be diagnosed as lupus. So if you have these symptoms, consult your doctor and get it checked. Thank you.